Okay, so we've established that our casualty is not breathing after using drugs, so now we need to administer CPR. This is an adult Annie. We will look at using child and infant Annies in another video. So with adult CPR, there's a few things to remember. You would go straight in with 30 chest compressions and then 2 breaths. You would alternate this until help arrived. You would use 2 hands, and this area of your hand is what you'd be using to push down. The positioning is you're looking straight down the centre of the chest and in between the nipples, and that's where you're aiming to push. The breaths, you would tilt their head back, pinch their nose and do 2 sharp breaths, and then continue with the compressions. In regards to the breaths, some people might not feel comfortable putting their mouth on another person's mouth. I really recommend the pocket masks, the disposable ones. Quite often you might find that people might have vomit on their mouth, blood, you just don't know. Cross-contamination, the pocket masks are amazing to have. You can get them on key rings, keep them in your handbag. Really, really, really useful. If it is the case that you don't do the breaths, just continue with the compressions. So you're looking to do about 100 to 120 compressions per minute, and you're doing it at 1/3 of the body depth, so quite a lot of force pushing down. Please make sure that before you start your compressions that you've either asked for assistance where somebody can help you and ring the emergency services, or you have rang 999 first, pop them on speakerphone, and then you need to crack on with the CPR. But make sure that you have done that before you start the compressions. Okay, so I'll do 10 for you, just as an example. I'll do 2 breaths also, and then we can move on to the child and the infant CPR. Okay, obviously you would do 30 compressions, but that's an example for you. I've actually just moved the camera just so I can show you the breaths properly, and you can see the chest rising from the breaths. So this is my 2 breaths after 30 compressions, and you're doing quite sharp breaths into the mouth. So you're tilting the chin back, you're pinching their nose, and you're doing 2 sharp breaths. And then you would continue with CPR.